family, welcome to another beautiful edition of Annie Author's vlog. If today's your first day watching me, you are in the right place. Please like, share and comment on my videos. So today's edition, we are zooming into health. So we are going to be talking about high blood pressure, hypertension. In other words, what is the normal blood pressure? Blood pressure is the pressure of circulating blood against the walls of blood vessels. So it is as a result of the heart pumping blood through the circulatory system. So it is the force of the blood pushing against the walls of your arteries. Each time your heart beats, it pumps blood into your arteries. So a blood pressure is measured in two metrics. The top number is called systolic blood pressure, while the bottom number is called diastolic blood pressure. So the unit of measurement of blood pressure is millimeter of mercury. So systolic blood pressure, which is the top number, is the pressure during a heartbeat while the heart is squeezing. Diastolic blood pressure, which is the bottom number, is the lowest pressure between two heartbeats while the heart is relaxing. So a healthy blood pressure ranges between 90/60 to 120/80. You know, some people say, hey, normal blood pressure is 120/80. Guess what? How many people are going to be hitting that specific target all the time? So that's why I put a range. Normal blood pressure is between 90/60 to 120/80. That is normal. Then again, according to American Heart Association, diabetic people, their normal blood pressure target is 140/90, while kidney disease people, their target is 130/80, and people who are 70 years of age, their normal blood pressure target is 150/90. So you see, there are so many differences in all of this. So we have been hearing blood pressure, hypertension, hypertension. What exactly is the cause of high blood pressure, hypertension? What causes it? Number one, excessive salt intake. If you eat a whole lot of salty food, please reduce it drastically. Age, if you are advancing in age, there's no way two ways about it. Some people develop high blood pressure with age. Number three, hereditary. If your mother had high blood pressure, your father had high blood pressure, there is a high tendency that you are going to develop high blood pressure in your 40s or in your 50s. One is sleep apnea. Sleep apnea is a condition where your blood oxygen level drops drastically during sleep. Another one is obesity. Are you chubby? Are you overweight? Do you have more meat on your bone? Try to drop it a little bit. Sedentary lifestyle, inactivity lifestyle. You're sitting too long, you're laying down too long, you don't move much. That is not good for your health. Drugs, alcohol, and smoking. Quit all three of them. They ain't good for your health. Poor or unhealthy diet. That means this will result into nutritional deficiencies. Stay on healthy diet. There's something we call DASH diet. That means dietary approach to stop hypertension, DASH. Another one is hormonal condition. You know, something like Cushing's disease, hyperthyroidism, hypothyroidism, all these things we have no control over it. So these hormonal conditions will cause somebody to have hypertension. Then another one is kidney disease, something like kidney stone, polycystic kidney disease, lupus, UTI, nephrotic syndrome. All the one is medication side effects. So some medications you take, the side effect is nothing but causing you hypertension. How about stress? Your daily activities can be very, very stressful. So please, as much as you can, reduce your stress level. Diabetic, this will also push them to develop high blood pressure. So if you're, in other words, it's interchangeable. Kidney disease and diabetes will cause somebody to have high blood pressure, while high blood pressure will also cause somebody to develop kidney disease. All these things are somehow interwoven. We need to be careful. So what are the different levels of high blood pressure? One is elevated blood pressure. That means your blood pressure is consistently between 120/80 and 129/80, your blood pressure is termed elevated. You can control this by diet and exercise and living a better lifestyle. Hypertension stage 1. So in this case, your blood pressure readings has been consistent between 130/80 and 139/89 millimeter of mercury. So at this stage, please take your medication as ordered by your doctor. Even if they are low doses, please stay on what your doctor have ordered. Again, maintain a healthy lifestyle and eat healthy as well. Then hypertension stage 2. In this case, that means your blood pressure readings has been over 140/90 consistently. So at this time, you have to be intentional, serious with your lifestyle changes, taking your medications and checking your blood pressure, reduce your work stress, as well as decreasing your salt intake. Take your daily or at least 3 times a week. Hypertension crisis. At this time, things are not going well. That means your blood pressure is about 180/120 millimeter of mercury. So at this time, having this blood pressure of 180/120 will be experiencing palpitation, chest pain, you know, the one side of the face will be drooping. That means there is impending stroke. The person needs to be careful. Some weaknesses on one side of the body, vision changes, the person will be seeing stars, nosebleed, even speaking will be difficult for this person. Having dizziness, anxiety issues, vomiting. You know, we need to be careful at this stage because anything can happen. So you need to go to the emergency room immediately. This is not a matter of you swallow double of your medication. No. You need to go to emergency room right away. Somebody needs to take you to the emergency room. If you're in a civilized world, you need to call the emergency number that will take you to the hospital. And so this is a stroke level. We don't need to joke about it. Then another one is hypertension urgency. That means your blood pressure is still over 180/120. But again, there are no organ damages when you have hypertension urgency. Another one is hypertension emergency. Your blood pressure is still over 180/120, but in this case, there is organ damage. That means the brain, the heart, the kidney, the blood vessels, there will be organ damage. We need to be very, very careful. So at this time, we call it hypertension emergency. Again, being in the hospital is just the best place you need to be, while the doctors will take care of you in the intensive care unit. This is not a joke. Somebody can go the other way if care is not taken. That's why it's called emergency. Again, I have listed what you need to do to keep your blood pressure low, or to make sure you don't develop it, or make sure you don't go into crisis. I have mentioned it along the way. Listen again if you miss it. Healthy diet, exercise, stop smoking, stop drinking, stop stressing, get enough sleep, check your blood pressure. All these things will help you to stay at least on a positive way. Thank you guys for listening to another beautiful edition of Annie Otta's vlog. I'm your girl, Annie Otta. I love you guys. Please like, share, and comment on my videos. Bye guys.